Good morning, OLE Health. This is a special edition video that we're bringing you to discuss the topic of public charge. Many of you have heard about this. It's been in the news. We've been talking about it for some months, and we recently have learned that this rule will go into effect. So I'd like to take the next couple minutes telling you what the rule is about, how it will affect our patients, and how you can be supported in answering questions that might come your way. So public charge is how U.S. Immigration officials decide whether or not someone can be welcomed into the country with a green card, or if they're applying for a green card if they're given that. Usually, and in the past, it was based only on people that received cash aid. The change is pretty significant. Now, immigration officials can look at people who are accessing a whole variety of government programs, including Medi-Cal, food stamps, Section 8 housing, TANF, which is also cash aid, SSI. They're taking a bunch of factors into account. As you can imagine, this is going to create a lot of fear and uncertainty in our patients and our community. We've already seen people who are eligible for programs disenrolling from those programs. Our job as trusted messengers in this community is to provide as much information as possible and to educate our patients so that they can make good decisions for themselves and their families. Because the truth is there's a lot of people that will not be affected by this. For example, children under 21 who are on Medi-Cal will not be affected. School free lunch programs, you can access those without any effect at all. If you're not applying for a green card, you already have it, and you're applying for permanent status, you will not be affected by this change. We don't want people disenrolling from programs out of fear. From now until October 15th, when the rule goes into effect, please encourage every patient to stay on the programs. This is not something that will be retroactive. After October 15th and the change will go into effect, we will need to have different messaging. We're in the process of putting that together, and we have these available already. It's in English and in Spanish, and another very user-friendly with graphics that talks about if the public charge may apply to someone coming in with questions. It's also in English and in Spanish, and it has the logos of all of our community partners for putting the same information out there. We'll have a training on September 30th that will be hosted at OLE Health that will be a lot more in-depth for some of our teams that come into regular contact with patients and are more likely to get questions, so stay tuned for more on that. And please, in the meantime, know that we are one of the largest providers. People will come to us, we will get questions, and we want all of you, the staff, to feel prepared with answers, support, and more than anything, making our immigrant community feel welcome and wanted and sending a message of love and support. Thank you.